Malaria. Mainly, vector for malaria is Anopheles. In rural, Anopheles culicifacies, and in urban, Anopheles stephensi. The infective form of malaria is sporozoite. Sporogony is a sexual cycle that is exogenous or occurs in mosquito. Schizogony is a asexual cycle, endogenous, and occurs in men. Now, through the saliva or inject metrozoid is goes to the infected person. Then that merozoids comes to RBC. RBC after merozoids comes from the RBC. Merozoids also known as trophozoites. Then from trophozoid, if at this stage mosquito bite, then this trophozoite convert into micro to macro gamete. Then zygote is formed. Then after zygote, ookinete stage, oocyst, then sporozoites. Now, malaria that is caused by the female Anopheles plasmodium species. There is incubation period like Plasmodium vivax having 12 to 17 days of incubation period. Uh, Plasmodium falciparum is most dangerous. That is incubation period is very short, like 9 to 14 days. Life cycle of Plasmodium falciparum. Sexual cycle occurs in primary host like in mosquito, and secondary host is human being. Sporozoites infect liver cells and mature into seasoned, which rupture and release the merozoites. First cycle is in the liver and it is known as the hepatic cycle. Then some are clinical features of malaria like prodromal patient having fatigue, malaise, body pain. Second one is cold stage. In that, the patient having chills, rigor, nausea, vomiting. That is last for 30 minute to 1 hour. Hot stages, patient feel heat, skin flush, temperature increase, patient feel thirsty, that is last for 1 to 4 hours. The last stage is sweating, that fever comes down, that lasts for 2 to 3 hours. Then what the fever patterns, simple tertian fever occurs every 48 hours in Plasmodium vivax. Simple quartan fever, that is in that nephrotic syndrome or in renal involvement, occurs every 72 hours in Plasmodium malaria. In Plasmodium falciparum, malignant tertian fever spikes daily but has no pattern. On examination, patient come after few days. Spleen is palpable. Pallor is present or maybe present or not. Lymph node are not enlarged. Lymph node are enlarged in Kala-Azar, typhoid. Like in chronic malaria, massive splenomegaly. There are causes of massive splenomegaly like chronic malaria, chronic Kala-Azar, portal hypertension, Gaucher disease. Plasmodium falciparum, also known as black water fever. Then in investigation, we send the peripheral blood film in. There are making two smears, thin or thick smear. In that, use Giemsa stain. A Giemsa stain also used in chlamydia, Borrelia rickettsia. Now, in uncomplicated malaria, no vital organs dysfunction. But in case of severe malaria, vital organs are dysfunction. Uh, then complications in case of malaria is cerebral malaria. Uh, Now, what are the treatment for malaria? We can also in investigation we do the rapid diagnostic technique like all antigen based like PCR, PLDH, PFHR, P2. Uncomplicated malaria. In uncomplicated malaria, drug of choice is chloroquine. The quinine is also used, that is in resistant malaria. Now, quinine having many side effects like hypoglycemia, chloroquine having side effects like hypotension, arrhythmia. We can also use artesunate and lumefantrine. So that's all about the malaria.